Hey guys, welcome. Thank you for stopping by the AAFE YouTube page. Here we are doing a very special treatment. So we are doing underarm neurotoxin. And what this does is it treats hyperhidrosis. And what does that mean? This is for patients that sweat excessively from their underarms. It can also be used elsewhere as well. But today we're treating the underarms. And so it's not just to treat normal amounts of perspiration, as of course we need to sweat. That is our body's way of excreting toxins. This is a great treatment for those patients who sweat pretty excessively. They have saturated underarms in their shirts. They've been dealing with this issue for a long time. No antiperspirant or deodorant seems to do the trick. This is a great modality for them. So you can see here quite a few injection points. We like to have about 40 sites per side. I typically draw up the neurotoxin, which is a hyper diluted form of neurotoxin, into 4 different syringes. I'm here using ComfortTox syringes. So each ComfortTox syringe holds 0.5 cc's or a half of an ml. And then I split it up into pretty much 4 different rows. You can see here that I kind of have a fifth and I adjust to each patient's anatomy. So wherever it seems that they're bearing hair or where those hair follicles are, that's where I will inject. And I'm going very superficial, as you can see. So you just want to reach the level of which those sweat glands are, and that's going to help treat them and prevent that hyperhidrosis. The goal is usually about 2 to 3 millimeters. These syringes that I'm using have a needle of 8 millimeters attached to them. So I like to go, pretty much just past the bevel. It's a little tricky to actually stay that superficial. So you can see here with my injections, oftentimes I'll go a little bit deeper and then kind of back up so that I'm at the level at which I want to be in. Procedure is relatively comfortable for patients, a little bit pinchy. Some of my patients choose to numb with some topical numbing. It does help a little bit. My patients are clean shaven when I do this. And just if there's, of course, I clean prior to injection if they have any deodorant on or anything like that. Just some alcohol to clean is great. Patients should experience some relief from this treatment, usually about 2 to 10 days after treatment. And then it lasts anywhere from about 3 to 6 months, I'd say. Every patient's a little bit different. You can see here, some of my injection points are getting a little bleb of product. Sometimes all of your injection points will look like that. Other times, none of them will. It does indicate that you are at a really good depth, but sometimes just depending on the patient's skin and the anatomy, you won't get that little bleb with each injection point. Following the procedure, your patient just really shouldn't manipulate the area, shouldn't sweat too much because that could make the product not work as well or the treatment be ineffective. But other than that, it is smooth sailing and this is a wonderful treatment. Thanks for stopping by.